Ever wondered why some couples struggle to conceive? Today, we delve into a less discussed topic: male infertility. Affecting about 20% of all couples, it's time we shed light on this issue. Infertility, by definition, is a failure to conceive after 1 year of unprotected, properly timed intercourse. In fact, about 15% of all couples experience infertility. Here's the kicker. Almost 40% of these cases are due to female factors, but a significant 20% are due to male factors. The rest is a combination of both or remains unexplained. The male reproduction process is intricate and delicate, involving the hypothalamic pituitary testicular axis, various hormones, and of course sperm production and delivery. Any disruption in this process can contribute to male infertility. So, are you ready to unravel the mysteries of male infertility? Let's dive right in. To understand male infertility, first, grasp the basics of male reproduction. The hypothalamic pituitary testicular axis, or HPTA, plays a critical role in this process. It starts with the hypothalamus, a small but mighty part of the brain. It releases a hormone known as GnRH in a pulsatile manner, acting on the anterior pituitary gland. This action stimulates the release of two hormones, LH and FSH. LH, or luteinizing hormone, acts on Leydig cells, which are found in the interstitial tissue of the testes. These cells are responsible for the synthesis and secretion of testosterone, the primary male sex hormone. On the other hand, FSH, or follicle-stimulating hormone, acts on Sertoli cells. These cells provide structural and metabolic support to developing spermatogenic cells, which are crucial for sperm production. Both FSH and testosterone work in tandem to support germ cells, which are responsible for spermatogenesis, or the production of sperm. Once the sperm matures, it embarks on a journey that takes it from the epididymis, a long coiled tube that stores and transports sperm, to the vas deferens. From there, it moves to the ejaculatory ducts and finally the prostatic urethra, where it's ready to be part of the ejaculate during sexual activity. Now, it's important to note that the journey of sperm is not just a simple swim, it's a highly coordinated process involving multiple organs, hormones, and cells. Any disruption in this process can lead to problems with fertility. Now that you understand the male reproductive system, let's talk about what can go wrong. Male infertility can be attributed to numerous factors, ranging from hormonal imbalances to structural abnormalities. Identifying these factors is key in diagnosing and treating male infertility. In the next part of our discussion, we will delve deeper into the etiology of male infertility. So, stay tuned to learn more about this complex issue. Multiple factors contribute to male infertility. Some are identifiable, others remain a mystery. Let's begin with idiopathic causes, those that are unexplained. They account for around 40 to 50% of male infertility cases. Despite extensive testing and evaluation, healthcare professionals may not be able to pinpoint a specific cause in these cases, leading to a diagnosis of idiopathic male infertility. Next, we have testicular factors. Varicocele, or enlarged veins in the scrotum, are quite common and can negatively impact sperm production and quality. They affect around 35 to 40% of men with infertility. Other testicular causes include tumors, congenital issues like Klinefelter's syndrome, post-infectious changes, uncorrected torsion, and cryptorchidism, which is when one or both of the testes fail to descend. Then we look at the obstructive causes. These can be due to past surgeries, infections such as gonorrhea and chlamydia, trauma, or congenital conditions like absence of the vas deferens, which is often associated with cystic fibrosis. Blockages in the reproductive tract, such as bilateral ejaculatory duct obstruction or epididymal obstructions, also fall under this category. A rarer cause is Cartagener's syndrome, an autosomal recessive disorder causing defect in the action of cilia, tiny hair-like structures that move mucus and fluid out of the airway. Next up, endocrine issues. Hormonal imbalances can seriously impact fertility. Kallman's syndrome, a form of congenital hypogonadotropic hypogonadism, and excess levels of hormones like prolactin, androgens, or estrogens can all contribute to male infertility. Lastly, let's touch on some other factors. Retrograde ejaculation, where semen enters the bladder instead of exiting through the penis during orgasm, can be caused by surgery. Certain medications, illicit substances like marijuana and cocaine, tobacco and alcohol use, and even lifestyle factors like regularly wearing tight pants or underwear can all affect fertility. Chronic diseases such as liver or kidney disease can also play a role. With such a broad range of potential causes, it's important to remember that each case of male infertility is unique. While this list might seem overwhelming, it's the job of healthcare professionals to sift through these possibilities, pinpointing the most likely cause or causes in each individual case. With so many possible causes, how do doctors diagnose male infertility? Let's find out. Diagnosing male infertility involves a careful examination of the patient's history and physical condition. To understand the root cause of infertility, we need to delve into the patient's past. This includes their medical history, where we look for past illnesses, surgeries, or any genetic syndromes. Has the patient had diabetes, cystic fibrosis, or sexually transmitted infections? Has he undergone vasectomy, hernia repair, or prostate surgery? These factors can all contribute to infertility. The patient's age and the age of their partner also play a significant role. As men age, their fertility naturally declines, so an older male partner can be a factor in a couple's inability to conceive. We also need to consider the patient's fertility history. Did puberty onset at a typical age? Have there been previous pregnancies? How long has the couple been trying to conceive? Has the patient undergone any fertility treatments in the past? All these factors can help us piece together the puzzle of infertility. Next, we move on to the patient's sexual history. Factors like libido, erectile function, ejaculation, and the timing and frequency of intercourse can all impact fertility. For example, intercourse that isn't properly timed with the female partner's ovulation can result in failed conception, even if both partners are fertile. The patient's family history can also provide valuable clues. If there's a history of infertility in the family, it could indicate a genetic cause. Medications are another crucial aspect to consider. Certain drugs, including cytotoxic agents, GnRH agonists, anabolic steroids, and some antibiotics and antifungals, can negatively affect fertility. Lastly, we look at the patient's social history and occupational exposures. Alcohol, tobacco, and illicit drug use can all impact fertility, as can exposure to radiation and heavy metals in the workplace. Following the patient's history, a physical examination is conducted. This includes assessing the patient's sexual development, examining the testicles for size, consistency, and nodularity, and conducting a digital rectal exam. But history and physical examination alone aren't enough. Diagnosis often requires more comprehensive investigations. To pinpoint the cause of male infertility, doctors often turn to laboratory investigations. These tests can offer crucial insights into a man's reproductive health and potential barriers to conception. The World Health Organization, or WHO, has established guidelines for what is considered normal semen values. These guidelines provide a benchmark for doctors to compare individual patient results and identify any potential issues. So let's delve into what these normal values are. The volume of semen in a typical ejaculation should be between 2 and 5 milliliters. The concentration should exceed 15 million sperm per milliliter. Regarding morphology, around 30% of the sperm should have normal forms. Motility, which refers to the ability of the sperm to move adequately towards the egg, should be over 40%. Liquefaction, the process by which semen becomes more liquid after ejaculation, should be complete within 20 minutes. The pH should be between 7.2 and 7.8, and there should be less than 1 million white blood cells per milliliter. One of the primary investigations in diagnosing male infertility is semen analysis. This test involves examining a sample of the man's semen under a microscope. It's important that at least 2 properly obtained specimens are analyzed over several weeks. This ensures that the results are accurate and not just a one-time abnormality. Semen analysis can reveal a lot about male fertility. It can determine the concentration of sperm, assess their shape and size, morphology, and measure their ability to move, motility. It can also detect any potential issues with liquefaction and the presence of any other cells or substances that could hinder conception. In addition to semen analysis, hormonal evaluation is also an important investigative tool in diagnosing male infertility. This is particularly indicated when semen analysis results are abnormal. Hormones play a crucial role in the production and health of sperm, and imbalances can lead to fertility issues. Tests can check levels of hormones such as gonadotropin-releasing hormone, GnRH, luteinizing hormone, LH, follicle-stimulating hormone, FSH, and testosterone, among others. So we've covered the causes and diagnosis of male infertility, but what about treatment? To find out, stay tuned for the next segment. Treating male infertility can be complex, often requiring a personalized approach. Each man's journey to fatherhood is unique, and so are the solutions to the challenges he may face along the way. One of the first steps in treating male infertility often involves lifestyle changes. This could mean quitting smoking, reducing alcohol consumption, or even changing the type of underwear one wears. Research shows that excessive heat can affect sperm production, so switching from tight underwear to looser options could make a significant difference. Additionally, maintaining a healthy weight and staying physically active can also improve sperm health. Sometimes, medication is needed to treat underlying conditions that contribute to infertility. For instance, men with hormonal imbalances may benefit from hormone replacement or medications. Antibiotics can also be used to clear up infections in the reproductive tract that may be affecting sperm health. In certain cases, surgery may be necessary. For example, varicocele, enlarged veins in the scrotum, can often be corrected surgically. Similarly, obstructions in the sperm transport system can often be repaired. Assisted reproductive technologies, or ARTs, are another key tool in treating male infertility. These techniques involve obtaining sperm through normal ejaculation, surgical extraction, or from donor individuals, depending on the situation. The sperm can then be inserted into the female genital tract, or used to perform in vitro fertilization or intracytoplasmic sperm injection. These advanced techniques have helped many couples conceive. It's important to note that the root cause of the infertility will guide the treatment approach. Therefore, a comprehensive evaluation is crucial for determining the best course of action. Remember, male infertility is a common issue. If you or someone you know struggles with it, know that help is available. It may take time and patience, but with the right approach and medical support, most men will be able to achieve the dream of fatherhood. Male infertility is a complex issue, but understanding its causes and treatment options can help demystify it. Indeed, as we've discussed throughout this video, male infertility is a significant factor affecting approximately 20% of couples struggling to conceive. It's a subject that may seem daunting, but with the right knowledge and medical assistance, it can be addressed effectively. Let's quickly recap the main points we've explored today. We've delved into the intricacies of male reproduction and how the hypothalamic pituitary testicular axis plays a key role in sperm production. We've also highlighted that around 40 to 50% of male infertility cases are idiopathic, meaning their cause remains unknown. However, a range of factors from testicular issues such as varicocele and tumors to obstructive problems and endocrine disorders can contribute to this condition. We've also shed light on how medical history, physical examination, and specific investigations can aid in diagnosing male infertility. The World Health Organization's guidelines for normal semen values have given us a baseline for understanding where issues may lie. Moreover, we've examined the various treatment options available, emphasizing that each case is unique and requires a tailored approach. Remember, the prevalence of male infertility underscores the importance of seeking medical help if you're experiencing difficulties in conceiving. It's crucial to remember that you're not alone in this journey and that help is available. Thank you for joining us to explore this important topic. If you found this video helpful, please subscribe to our channel MedSign Health 360 and give this video a thumbs up. Your support encourages us to continue creating high-quality, accessible content on crucial medical and health subjects. We value your thoughts and insights, so don't hesitate to share them in the comments section. Together, we can bring high-quality medical and health knowledge to everyone. Stay healthy, and see you in our next video.